okay? So CO2 plus water will give you carbonic acid, which then gets broken down into hydrogen ions and bicarbonate ions, okay? Now, when you have the regulation of the pH of the blood, it is mainly regulated by two different processes, two different organ systems. One is the respiratory system, and the respiratory system can only manage the CO2, okay, in this particular equation. So if you manage the CO2, you can also adequately manage these two compounds as well. Whereas the other organ system in the body that helps to balance the pH of the blood is your kidneys. So the urinary systems, through a series of filtration, reabsorption, secretion, and all that stuff. Remember, one of the functions of the urinary system is to regulate the amount of hydrogen ion concentration, and therefore also help to regulate the bicarbonate concentration to help regulate pH, okay? Now, in the body, there are actually two causes that leads to an acid-base imbalance. One of those causes can be attributed to the respiratory dysfunction. So any kind of respiratory issue that you may have, basically if the patient is breathing too slow or too fast for whatever reason, not by voluntary effort, but some kind of toxic compound or noxious compounds or something else that basically causes your ventilation to increase or decrease beyond the normal range, then you will either lose too much CO2 or retain too much CO2, okay? So it depends on what it is. It can lead to a shift in your pH, because let's say if you retain too much CO2, CO2 will create more hydrogen ion. And if you have more hydrogen ion, that then leads to what we call an acidosis, okay? So if the problem of this acidosis comes from the respiratory system, we call this respiratory acidosis, okay? Now, if for some reason your body is getting rid of too much CO2, if you're hyperventilating or breathing too fast, you're getting rid of all that CO2, then the hydrogen ion and the bicarb will have to combine together to reform the CO2, because this is a balanced equation, right? So you start to decrease one of these, then these two compounds must reform that. And because of that, as you lose the hydrogen ions, then the pH inside your blood becomes more and more alkaline. So if that's the case, because it's a respiratory cause, which means there's a decrease in CO2, leading the pH to increase above 7.45, and that is a condition we call respiratory alkalosis, okay? So these acidosis and alkalosis, which is a shift in the pH below or above the normal range caused by the respiratory system, results in either respiratory acidosis or respiratory alkalosis, okay? Now, on the other hand, you have a lot of metabolic activities that goes in within your body. Not just the kidneys themselves, but all the cells are going through all this stuff. So there are metabolic causes as you start to either accumulate too much acid, or you start to, for some reason, decrease the amount of bicarb inside your body through metabolic activities. Then this will lead to a shift in your pH and cause the pH to decrease below 7.35. If the change in pH is caused by metabolic activities of the body, then we call this metabolic acidosis, okay? On the other hand, there's other series of metabolic activity that goes on within the body that causes an increase in overall bicarbonate. If you have too much bicarb lingering around in the body for some reason, or if you've lost some degree of hydrogen ions, then the pH is going to increase, right? Because if you start to decrease hydrogen ion, the pH increases. Now, if the pH increases above 7.45, this is called alkalosis. But this alkalosis is caused by some kind of metabolic activities of the body. Hence, we call that metabolic alkalosis. So the pH imbalance in your body can be attributed to 4 different conditions, either respiratory acidosis or respiratory alkalosis, or metabolic acidosis and metabolic alkalosis, okay? So these are the only 4 acid-base imbalance that we need to really worry about, okay? So what are the causes of some of these particular type of conditions? Because that's what we have to know. So let's look at the cause. So for respiratory acidosis, this is something going on inside the lungs that causes you to retain too much CO2. Right? If you retain a lot of CO2, what happens is that the CO2 will combine with water, to form more hydrogen ion and therefore causes the pH to decrease. So we call this hypoventilation. This is hypoventilation that you cannot control. It's not like you hold your breath and it's going to lead to respiratory acidosis. That doesn't happen, right? Because you hold your breath for a certain amount of time and eventually you're going to have to breathe again to compensate for that. So therefore you will quickly correct this pH shift. It's not long enough for you to have this pH shift to have an acidotic type of condition. So therefore this hypoventilation is something that you cannot consciously control. Whatever is happening in this patient, the patient is now just breathing much slower. So there's a neurological stimulation to this, or some kind of dysregulation of the chemoreceptor reflex that basically allowing you to breathe faster or slower, or whatever the case is, right? So therefore, some of the causes that can contribute to this hypoventilation would be something like opioid overdose. Okay? If you consume too much painkillers, the painkillers themselves decreases the neurological activities that regulates your diaphragm and your intercostal muscles. And because of that, you now have a depression in your respiratory rate that you cannot control. It's not something that you can consciously control. So opioid overdose will lead to that. So therefore, later on when you guys sit for standardized exams and stuff like that, when they ask about these type of acid-base imbalance, they really like to give a scenario of a person that has overdose on opioid. But they don't tell you that because you will be one of the first responder that received this patient. And the EMT that brings this patient into your clinic is going to report the fact that they found this person unconscious with an empty pill bottle next to them. And they don't tell you what that empty pill bottle is. So the most likely scenario is opioid overdose. Okay? However, that's been used many, many times, so therefore, who knows, they may change that, right? So by the time you guys get to that stage when sitting for those standardized exam for your nursing program or whatever programs that you're trying to get to, the NCLEX or whatever it is that you're trying to, pass in order for you to get your nursing licensing, most likely scenario that will present to you if there is this, kind of acid-base imbalance, right? I've seen that all the time. I've actually written questions on this for the board exam as well. So therefore, I know it's in there circulating around somewhere. Some of these questions are retired, so who knows, right? Okay, so opioid overdose is one of the mechanisms that leads to hypoventilation because it depresses your respiratory responses. Therefore, you're gonna breathe a lot slower, which means you're gonna retain more CO2, which means you're gonna make more hydrogen ions, which then causes the pH of the blood to basically decrease below 7.35, okay? Another way to induce hypoventilation is if you have some kind of chest trauma. Right. You get into a fight with your significant other, they get mad at you, they jump to your car, run you over, and now your chest is crushed. Or they get so mad at you, they hit you and they break your ribs. That's chest trauma, right? So when any of these anatomical structures is damaged, you can't expand your thoracic cavity enough in order for you to breathe in and breathe out. And therefore, your breathing becomes very shallow, okay? Pain is also one of the causes of hypoventilation. Because when you're in pain, a lot of time people don't want to breathe that hard, right? Especially if it's like back pain or whatever pain. I mean, you think about it, any kind of pain, especially around the axial area, around the body area, right? You don't want to move. Especially lower back pain or whatever the case is, anytime you move, it hurts. So therefore, you're basically lying still most of the time and you're breathing really shallow. So that can also lead to some degree of that respiratory acidosis. Okay? Other conditions of the body includes things like pulmonary disorder, asthma, COPD, things that restrict or obstruct the passageway of air. So for patients with like COPD, they can't get air into the lungs, so they retain a lot of that CO2, which means they can't exhale that CO2 out enough, right? For asthma, sometimes you have what we call expiratory wheezing, which means they can breathe in, but they can't breathe out, so they retain a lot of that CO2. Okay? So all of these will lead to some kind of hypoventilatory activities, which retains your CO2. So therefore, any respiratory issue is going to due to a discrepancy in your CO2 concentration. Okay. All right. So that's some of the causes. Now, when you have respiratory acidosis, then most likely going to show you the pH of this particular individual. What's the pH going to be? High or low?
High.
Low. Acidosis, man. So low pH. What's the CO2 level is going to be? High or low?
Low.
You're retaining it, right? So high. So high PCO2. Okay? All right, good. So that's basically some of the parameters that will give you in the blood draw or whatever it is, lab analysis that they give you, because usually for a standardized exam or anything like that, they'll give you something to kind of clue you in on what's happening with this patient. So patient was brought into the ER unconscious, respiratory rate is 6 instead of the usual 12 to 16 breaths per minute, so whatever it is. So they'll tell you the respiratory rate, and then from that, you have to deduce the fact that this person is hypoventilating. They're not breathing normally, right, for whatever reason. And of course, they can, you take the blood draw and you see that the pH is low, but the CO2 level is high, okay? So that's a clue. Now, for respiratory alkalosis, whatever is happening there is happening in the lungs that you cannot control. So the issue of this is, for whatever reason, you are now getting rid of too much CO2 from the body because it's a respiratory cause. So therefore, you're breathing fast and therefore getting rid of the CO2. The hydrogen ion and bicarb have to recombine to reform some of that CO2, therefore decreases your hydrogen ion concentration, which increases the pH. Okay? So the cause of respiratory alkalosis is hyperventilation. Okay? Now, what can cause some of this particular activities that leads to hyperventilation? Well, you have to have things like anxiety. Right? You ever see a person that has a anxiety attack? This person will just go and they cannot stop, right? You look at them and they're like, dude, you are making me tired by breathing that fast, right? Something's going on with them that basically they can't control that breathing. So therefore, there's a discordance of that neurological input and causes this increase in ventilation rate for these patients, okay? If this patient is in high altitude, automatically they will start breathing faster. Why do you think that is?
Less oxygen.
Less oxygen in the air. So because there's less oxygen in the air, the body's automatically kicks in because of that chemoreceptor reflex, stimulate an increase in ventilation activities, ventilation rate, therefore your breathing rate goes up, okay? All right, now of course, as you're doing all this, you're getting rid of CO2, what happens is that there's a shift in the pH, so therefore the pH goes up above 7.45, we call this respiratory alkalosis. So if you measure the pH will be high. How about the CO2? CO2 will be low. So decrease in partial pressure of CO2. Okay?
You mentioned how chest trauma prevents you from breathing more.
Mm-hmm.
What if you have, let's say, a lung puncture? If we're not looking at
That's the same
bleeding
thing.
out,
Yeah, you're still,
but aren't you getting more?
a lung puncture, you're getting less. Depends on how far that puncture is. Either case, it's gonna collapse your lungs. How are you getting more oxygen? Right? So if you get, like, let's say a stab wound or a bullet wound into your chest, the thoracic cavity, let's say puncture your lungs, right? It forms a suction effect, therefore increases the pressure, pushes down and collapses your lung altogether. So we call that a pneumothorax. But if there's blood filling up in the pleural cavity, we call that hemothorax and stuff like that. That increases the pressure significantly, causes the lung to collapse because you can't inflate your lungs anymore. Okay? So yeah, in those cases, the patient will barely be breathing, right? Very shallow breathing, and very, like, the heart sound is super distant. You can barely hear it as well. Okay, so causes of your respiratory acidosis and alkalosis, okay? How about metabolic causes? So for metabolic acidosis, something is happening that causes a decrease in the bicarb. Okay, if you have a decrease in bicarb, that means you have more hydrogen ions lingering around. If you have too much hydrogen ion, it's gonna overwhelm your bicarb system, right? So it's either due to mainly a decrease in bicarb that could be contributed by an increase in hydrogen ion in the first place. If you have too much hydrogen ion, you overwhelm the buffering system of the body, and therefore now the pH decreases. So some of the causes could be overproduction of what we call non-volatile acid. Okay, and non-volatile acids are like your ketone bodies or your lactic acid. All right. Ketone bodies are due to acetyl-CoA formation from the breakdown of your fatty acids. If you don't use all of that particular acetyl-CoA, some of the acetyl-CoA combine together to form ketone bodies, and ketone bodies are extremely acidic. And it's a non-volatile acid, which means you cannot neutralize that thing very quickly. You have to metabolically break it down and excrete it, or whatever the case is, right? In order for you to kind of neutralize this pH change. So overproduction of non-volatile acids, let's say you have diabetes of some sort, or let's say if you're not breathing adequately while you're exercising and you're producing too much lactic acid, stuff like that. That will lead to some form of metabolic acidosis, okay? Because what happens here is that it's gonna start to overwhelm this buffering system. So for metabolic causes of acid-base imbalance, it is due to the changes in your bicarbonate concentration, more so than a hydrogen ion concentration, okay? Another cause of metabolic acidosis is what we call loss of bicarbonate. How do you lose bicarbonate from the body? Urea? Not urea. There's bicarb in the urine, but where are most of the bicarbs stored in your body? Or where do you see within the body itself a very high amount of bicarbonate?
In your stomach.
Where?
In your stomach.
Oh, better not be the stomach. What's the acidity of what's the pH of the stomach?
Oh, 2 point.
Yeah, so there's a lot more hydrogen ions compared to bicarb. Bicarb is just there to neutralize it. So in your intestine, small intestine, large intestine, how do you lose the bicarb from your intestine? How would you remove bicarb from your intestine? Quickly, explosively. It's called diarrhea. Okay, so you have diarrhea, you will start to lose bicarb. And if your diarrhea is severe enough, then you will be in metabolic acidosis. Okay, because now you have less bicarb to potentially neutralize the hydrogen ions that's within your body, and therefore this causes the pH to go down, to decrease. Okay, and a third cause, which is a very minor cause, is oftentimes overconsumption of acid. Decide one day to just, see a liter or whatever it is of Coca-Cola in your fridge that you left there for so long, all the fizz has already gone, all the carbonation has already gone. Now the only thing left is like the syrup. But you're like, you know what, I feel like, and I want to, I don't know, for some reason, I'm so thirsty and I just can't taste water. So I wanna basically drink this, this thing is. So you start to chug that thing, highly acidic. That's just a weird example of it, right? So, or you decide to like take a bunch of lemons and you just like gobble all that stuff because who knows, you heard that's gonna cause you to lose weight or something like that. So it's called a chemical diet, by the way, if you want to do that. So basically, if you want to stimulate your digestive system, stimulate the activities of your intestine throughout the day so it can increase in metabolic activities to constantly break down and digest food quickly. First thing you do in the morning, don't eat anything except for an orange. Eat a citrus fruit. And don't eat lunch until much later. Okay? Or skip lunch altogether. And then eat a hearty, healthy dinner, right? Balanced dinner, stuff like that. Maybe more proteins than anything else, but that will lead to an increase in that metabolic activities. Therefore, you will, and some people have done that. Not just that, but then the diet is very rigorous. It's a 1 month diet that they say you can lose up to 30 pounds. That's pretty excessive, if you ask me. But some people just want to look good for their wedding or whatever the hell they're doing. So, metabolic acidosis. Okay, don't do strange things to put yourself in a situation like that. All right, so now you also have metabolic activities that lead to a shift in your pH and causes the pH to increase above 7.45, which basically means in this particular metabolic alkalosis, you are now retaining too much bicarb. Or because you've lost too much hydrogen, that's why your bicarbonate ions are now much higher, okay? So one of the cause of this is overconsumption of bicarb. So like I said, you wake up one day and you're like, you know what? I kind of feel like a bottle of Tums today. Just pop Tums for the rest of the day, right? I'm gonna skip my meals because I heard this is gonna help me, I don't know, gain more energy. I don't know, whatever the hell we read on YouTube or Facebook, right? Follow the trend that's laid out for you by AI. Second thing that may cause this overall pH shift is if you have lost some acids. So how do you lose acids? Yeah, because most of your acid is in your stomach. So therefore, if you vomit, you will lose the acid from your body. Good. So these are the causes, mainly, of these 4 different types of acid-base imbalance, right? If you know this chart well, you should do okay on the final exam. Oh, and you guys understand we still have a lab quiz coming up too, right? It's gonna come up soon, probably after Thanksgiving. Anyway, and remember the lab quiz is gonna quiz you on every single lab that we had in this semester. Every single lab. You have all the labs. You can just quickly review it. One day, I'm not gonna tell you when, one day, I'm gonna start to quiz you on it. Okay? It's gonna be a pop quiz.
Like, on the stuff we do in the test, or
No, on the lab activities.
Okay.
Yeah. So every single lab activities, there's a description of why you're doing those lab activities, right? A description of the topic. That's what I'm gonna quiz you guys on. Does that make sense? Okay. So like today, acid-base imbalance, right? What's the purpose of that? What's the point of that? What are the different acid-base imbalance and stuff like that? How would you describe it? How would you define it? So basically all the information's there. It's not about the activities that you did, because who knows, or maybe I can ask you about those activities, which then leads to you answering the questions about the topic of whatever that lab is, right? So
Is it sure knowledge enough to answer?
based on the scores that we've been getting. Have you seen the size of our class?
I have a question.
Yeah.
Can you because you said overconsumption of acid can lead to weight loss or whatever. Can overconsumption of bicarbonate lead to weight
No, I'm just making that as an example, like something that you may have seen or heard or read, but it's not based on any kind of fact or evidence, right? It's just a fallacy. a myth, so to speak, right? It's like bloodletting is gonna increase, you know, your health or whatever the case is. Something like that, some weird stuff like that. Plucking hair and stuff like that will increase hair growth. Who knows? It may also lead to baldness, who knows? Nobody tells you. So yeah, none of that stuff. But the chemical diet is a real thing. It was proposed by some kind of, shoot, I forgot what kind of doctor he is. But he basically proposed it because he has like a degree in nutrition as well. But he basically made that diet because some of his clients, some of his patients kept harassing him about like the trend, the dietary trend, and why it's not working. Every single time they go on it for some amount of time, they always have rebound weight gain, and the rebound weight gain is like twice as much as what their original weight was. So why is it not working and stuff like that? So he got fed up with it, and he's like, fine, I'm gonna make you guys a diet, so shut the hell up and just take these things and stuff like that. But then it's kind of excessive in a way, so therefore, I think at one point, everybody got a hold of it. When I was working in a pulmonary clinic, we all did it. I did it too. I cheated a lot because I couldn't stand eating all like broccoli for 24 hours. Like, that's crazy. So anyway, I actually lost like 10 pounds. So that's not too bad, right? But other people have said they've lost about like 15 to 20 pounds and stuff like that. Now, can they keep it off? That's up to them, right? If they continue with that trend and change the way they see food and eat food and stuff like that, yeah, you can keep it off. But if you're just following dietary trend, you will never be able to keep off the weight that you want to. Right? All right, anyhow, how do we compensate for all of these type of acid-base imbalance? Because your body have to have a way to compensate for this. So compensation for respiratory acidosis, compensation for respiratory alkalosis, compensation for metabolic acidosis, and compensation for metabolic alkalosis. Okay, so remember there's two organ systems in the body that regulate your pH. One is the respiratory system, the other one is the urinary system. Okay. Now, if you have a respiratory acid-base disorder or imbalance caused by a respiratory issue, you cannot use the respiratory system to compensate for that. Obviously, it makes sense, right? I mean, if you're the one causing the problem, you're not the one that's going to solve the problem because you're the one that causes the problem in the first place. So therefore, for any respiratory type of acid-base imbalance, the only compensation that you can actually employ is your urinary system, is your kidneys. But the kidneys take time in order to kick in to essentially compensate for all of this acid-base imbalance. Okay? So therefore, for respiratory acidosis, to compensate for this, the kidneys will be the main organ system that compensates for this. And how the kidneys do this is by two ways. Immediately, well, almost immediately, the kidneys will secrete hydrogen ions. Okay, so start to take hydrogen ions and release that out into the filtrate, into the urine. Now, it can do this for some amount of time because the pH of the urine is about 6, which is more acidic than the pH of blood. Does that make sense? Because it has a lot more hydrogen ions and other waste material. Because remember, in that reabsorption and secretion process, at the proximal and distal convoluted tubules, we are mainly secreting hydrogen ions into the filtrate from the blood. So therefore, the filtrate equals the urine, and the urine is more acidic. So the kidneys don't mind that the urine is acidic at a pH of 6. However, if you have an acid-base imbalance, and you have a lot more hydrogen ions lingering out inside your blood, and the kidneys are now increasing, sorry, I should say increase in secretion, not just secretion. Increase secretion of hydrogen ions. Okay. So let's say if the kidneys increase the secretion of hydrogen ions, what's going to happen to the pH of the urine? Is it going to become more acidic or is it going to become alkaline?
More acidic.
It's going to become more acidic. Now, once the pH of the urine decreases down to about 4, the kidneys shut down. okay? So the amount of hydrogen ion secretion is very delicate. So therefore the kidneys can only secrete a certain amount so that it can help regulate the pH of the blood. If you have an imbalance in the pH of the blood, then the kidneys, as it tries to secrete the hydrogen ion, it knows, all right, there's a limitation of how much of this hydrogen ion I can actually secrete out to try to bring the pH of the blood kind of back to balance. But if it continues to secrete hydrogen ions, then it actually causes the kidneys to shut down. That's the only compensatory mechanisms you have left. If you shut down your kidneys, in this case, you will die, okay? So therefore, this is not the main way for the kidneys to compensate for respiratory acidosis, but it is the almost immediate way that the kidneys is doing so. However, the kidneys realizes this, and the main way for the kidneys to help regulate or compensate for this is to increase reabsorption of bicarbonate. Okay, so this is the main method of compensation produced by the kidneys in response to respiratory acidosis, because it's going to take back more bicarb from the urine itself, and therefore will neutralize some of that pH shift that's going on in the blood, right? Bring the pH back up to normal, okay? For respiratory alkalosis, because now you have too little amount of that particular hydrogen ion, or too much bicarb, or whatever the case is, right? So then what you want to do is you want to limit the amount of bicarb that is being taken back into the blood. Does that make sense? Because you have too much lingering around due to the fact that you have too much CO2, or whatever the case is, or sorry, too little CO2, and then basically it neutralizes some of that hydrogen ion. So therefore, you don't want too much bicarb to basically be around, because it's going to lead to this alkalosis. You can't do anything with the lungs, because the lung is the cause of this acid-base imbalance. So therefore, the kidneys have to also kick in. And what the kidneys do in this particular case is to decrease the reabsorption of your bicarb. Okay? So if you have too much bicarb lingering around, you're gonna have to filter that bicarb out. But as you're filtering the bicarb out, you don't want to take it back, because if you take it back, then you will enhance this alkalotic activities or alkalosis inside your blood. So therefore, the kidneys will decrease the reabsorption, so your urine can get rid of that bicarb from the body. Okay? Now, what is going on here in the urine if you have too much bicarb in the urine and you don't take it back adequately? What's going to happen to the pH of the urine?
Increase.
It's going to increase. So the urine now becomes more alkaline. As the urine becomes more alkaline, you now have an increased risk of forming kidney stones. Okay? So kidney stones are tiny little calcium stones and stuff like that. And it's not really microscopic, it's like 1 or 2 millimeter in width or whatever it is. But when those stones are formed and it's moving down your ureters, and it gets stuck somewhere along the ureters, because as the ureters come down and enters your urinary bladder, there's a bend in the ureters, and therefore some of those stones may get stuck in those areas within the pelvic cavity. This causes an enormous amount of pain. I've never had a kidney stone, so I don't know what the pain feels like. But what I've learned from a lot of these particular, references and stuff like that, and from account of the patient, imagine you take a razor blade and you run it from your flank down to your groin, up to your flank, down to your groin, up to your flank, down to your groin, and do that repeatedly and never stop. That's what the pain feels like, okay? And remember, pain is tonic, which means there's no adaptation to that pain. It is constant as long as the pain sensation is there. So therefore, a lot of patients that go into the ER because of this kidney stone, they're trying to pass a stone, and the stone gets stuck somewhere, they're in an enormous amount of pain. They're writhing, on the floor of the ER, which, is super clean, right? And all that stuff. So therefore, typically what we do with them is we give them morphine. And almost immediately, the pain dissipates and they feel euphoric. And that's the reason why it may lead to opioid addiction and overdose. Anyhow, so reabsorption or decrease in the reabsorption of bicarbonate, okay, which basically leads to an increase in excretion of your bicarbonate. Okay, so that's the compensation for respiratory alkalosis. Now for metabolic acidosis, here caused by metabolic issues, since this is not due to the lungs itself, you can actually use the lungs to compensate for this. So the lungs are gonna kick in, and this is gonna be the acute phase of this compensation. Acute phase is facilitated by the lungs. And you think about this, if you have a loss of that particular bicarb, or you have too much non-volatile acid, or whatever the case is, then what do you want to do to help decrease the amount of hydrogen ion concentration? Because you have a high amount of hydrogen ions right now, right? So how would you want to lower that hydrogen ion concentration using your lungs? Because first of all, keep in mind, the lungs can only effectively change the CO2 amount. So using this equation, what do you want to do in order to bring the hydrogen ion level slightly downward? Shallow. If you shallow breathing, you're gonna retain more CO2 and then you're gonna make more hydrogen ion. You will kill your patient.
So you breathe hyperventilation.
Hyperventilate. So the patient will hyperventilate. Okay? As a compensatory mechanism for metabolic acidosis. But how long can you actually hyperventilate? Try it. How long can you persist? Like Anton almost passed out the other day, right? Doing that activities when he's like, well, at least somebody's like, Anton, don't slow down your breathing, you're gonna pass out. It looks like you may be passing out. Maybe he's just tired and sleepy, who knows? All right, so we can't do that for a prolonged period of time. So therefore, chronically, as a chronic compensatory mechanism, your kidneys have to kick in. So the kidneys will kick in. And when the kidneys kick in, they do exactly the same as they do here. They will first increase secretion of hydrogen ions, but more importantly, they will increase the reabsorption of your bicarbonate. Okay. Good. Now, for metabolic alkalosis, since the lungs are still intact and not causing this issue acutely, you will have the lungs kicking in. Now, what do you want to do with the lungs in order to decrease this pH? Yeah, because when you hypoventilate, now you retain more CO2, and then you make more hydrogen ions. Okay, kind of help to bring the pH back down, so hypoventilate. Now, chronically, the kidneys will also kick in. And they will do exactly what they did here to decrease the reabsorption of bicarb. But as far as hypoventilation is concerned, you can actually hypoventilate for a very long time. You can't hyperventilate that long, but you can actually hypoventilate for a much longer period of time. Okay? So therefore, hypoventilation is actually the main way to compensate for metabolic alkalosis, more so than the kidneys kicking in to decrease the reabsorption of bicarbonate ions. Okay? Because then there's nothing really that regulates that. The kidneys just automatically does it on its own. Okay? All right, so keep that in mind. Now, another thing I forgot to put in is because we have these, right? We have these labs here for acidosis and alkalosis caused by some kind of respiratory issue. What about metabolic acidosis? What kind of lab will you see? What's the pH going to be? Yeah, low pH because it's acidosis.
CO2.
We don't care about CO2 in this case. What's the bicarb going to be? about metabolic alkalosis? pH, high. Bicarb, high. So if you look at this, and this is not going to be the only lab they give you. They'll give you a bunch of other labs to kind of distract you from this. And if I'm asking you these questions, I'm going to do the same thing too, right? So keep this in mind. If you think it's a respiratory acid-base imbalance, the pH change and the CO2 change are opposite. Okay? So for respiratory acidosis, you have low pH but high PCO2. For respiratory alkalosis, you have high pH but low PCO2. For metabolic causes for acidosis and alkalosis, the change is in the same direction. So therefore, for metabolic acidosis, the pH is low, but the bicarb is also low. Okay? And for metabolic alkalosis, the pH is high, and the bicarb is also high. Okay? So kind of keep that in mind. Okay? It doesn't matter what kind of distraction they put in there, or I put in there, you should be able to kind of look at this and kind of, comprehensively figure out what's going on with the patient. Now, what if the patient comes in your clinic and they're hyperventilating? Are they doing so as a compensatory mechanism for metabolic acidosis, or are they hyperventilating as a cause of respiratory alkalosis? You have to make that determination. Right? That's all I'm going to tell you. I may or may not ask you questions like that clinically, right? Trying to assess the patient. So.
Would you have to check them for levels of CO2?
Of course. Absolutely.
Fine.
And you also have to assess whatever situation is going on with the patient, right? Does the patient look like they are in high altitude? Does it look like they have some kind of anxiety disorder and basically now causes them to hyperventilate? Or are they, because they're hyperventilating, due to the fact that they're diabetic? Right? Patient that comes in with diabetic ketoacidosis are hyperventilating. They're breathing really fast. Right? So because they're trying to compensate for this metabolic acidosis that's going on. Therefore, the next time you guys have diarrhea, while you're sitting there, note your breathing rate, your respiratory rate. You will start to breathe a little bit faster. Okay. The next time you guys go out drinking and you go home, you have to hug that porcelain goddess because you're throwing up all over the place. Take a moment, pause, and think about your breathing as well. You will start to breathe a little slower than what you normally do in the midst of throwing up. Oh, damn, I am breathing slower. I think the last time I threw up, I was thinking about that too. That's why I stopped for a moment. I was like, oh yeah, damn thing does work. Anyway, that's space and balance. Okay, any questions? No? Sure. Okay, go on.